The brain said it was the most important part of the body because I control everything that goes on in the functions of the body. Finally, the bum spoke up and said, no, I should be the boss. You want to know why? Because I control the functions of the body. All the rest of the bodily functions decided to laugh at the bum and said, what are you talking about? So the bum said, you know what? I got this. I'll play a joke on them. It started laughing and it blocked itself up, refused to start working on time, to block everything up. And everyone was like, oh my gosh, we can't function. Not at all. So the bum is like, do you have a problem? Everyone's like, you can be the boss now. We're not worried about that. You want to know the moral of the story? You don't need a brain to be the boss. All you need is a colon that will work. My mother is the one that was located in the hospital and later found out that her colon was not functioning. It had burst and later went septic and was given a 2% chance to live. The American Cancer Society have estimated in the year 2016, 95,270 new cases of colon cancer alone, 39,220 cases of rectal cancer. In order for it now, it's late or not, we must cover a couple of symptoms and risk factors in cases that you have not known. A couple of symptoms: it changes the bowel movement. It can go from diarrhea to black, hard stools. You'll also have blood in your stool, persistent pain in your left side, where your colon will normally be, where your small and large intestines located at. There are just a few of the symptoms that are well known. The causes, in most cases, there's not a clear cause in reference to what they know and what it starts. Some of it's saying that the healthy cells of the DNA starts to break down and there's an error in that DNA that causes the polyps and the cancer in that. There is also a possible way to inherit the colon cancer genetic gene of that. Some of these diseases that are also with the colon cancer that are formerly known or sometimes not known is the hereditary non-polyposis colorectal cancer, is also known as HNPCC if they want to shorthand it. They also have ulcerative colitis, is also something my mother had, and it can also have Lynch syndrome. They can also have Crohn's disease, familial adenomatous polyposis, which is shorthanded of FAP, F-A-P, a rare disease where it develops in the lining of the colon and the rectum. Those are just a few. Some of the risk factors are old age. That's why over the age of 50, they tell you to go get a colonoscopy done. And then depending on how those polyps come back, or the colonoscopy comes back, they will have you come back every 5 to 10 years, or every 1 year if they see a change in that. African American race, they are at a greater risk of colon cancer due to their race alone. Personal history of colorectal cancer or polyps, that'll also go with you having the cancer, not the cancer, but the colonoscopy done as well with your doctor over the age of 50. Being diabetic, being type 2 diabetic, being an alcoholic is also a risk factor. Being obese can also be one of those risk factors for you. Smoking is also one of those risk factors. Those are just to name a few. There are also stages of cancer. You have stage 1, stage 2, stage 3, and stage 4. Stage 0 are the abnormal cells found in the innermost lining of the colon. Stage 1 is the abnormal cells that have become cancerous that have spread from the colon into the middle lining from the colon wall. And stage 2 is the cancer that has spread beyond the middle layer of the colon wall and nearby the tissue or the organs. Stage 3, the cancer has spread to the outer layer and near the tissue, organs, and 3 or more lymph nodes. Stage 4 cancer has spread to the nearby lymph nodes and has spread to other parts of the body, such as the liver and lungs, and starts everything to shut down from there. As you'll see right here in the chart, you have a 5-year survival rate. When you're at stage 1, you're at 90%. That's your highest rate when you're at stage 1. If you can catch that early, that's what you would like to try and do. At stage 2, you're only having a 60% chance of survival rate. Stage 3, depending on when you check it or when you catch it, you have a 35 to 60% chance of surviving it and beating it. In stage 4, they only give you a 10% chance. And with my mom, they gave her a 2% chance. Although most people experience similar symptoms at the end of their life, it means every experience leading up to it, that moment, is highly individual. And this is per Julie Wilkerson, which is also a BNS RN. So if you think that any of these symptoms might fit your situation, any of these cases, any of the risk factors, you might want to get checked out, because some of these can already be in your system and you'll never know. If you would like any information and where I received half of this information from, you can go to mayoclinic.org/disease, or you can go to fightcolorectalcancer.org, and I have a phone number for you. It's 1-800-227-2345 or 877-427-211. Another information phone number you can also get is 865-299-6257. Thank you.